All right.
Great. Well, welcome everyone. My name's Jane Parker. I'm Monterey County Supervisor for District 4. This is the September 14th, 2020 edition of Hot Topics. It's 5:30 and we're going to go ahead and get started. Tonight we're going to be talking about COVID-19 testing. And I have two special guests this evening, Dr. Bakhda and Dr. Blum, who are very interested in pursuing rapid testing. And so I think what I may do, I don't know which of you wants to speak first, I'll leave that up to you, but I think it would be really helpful for our participants and viewers. We have some on Zoom and we have some on Facebook Live. And by the way, I want to encourage our participants as we go to ask any questions that you have. Put your questions in the chat or in the question and the answer, and I will receive those and speak them to our guests so that we have a chance to cover any questions or comments that you want to make on this topic or others, but I'm going to give preference to the testing topic. So what I was going to say was maybe one of you could just start off by talking a little bit about the kind of the progression of what testing has been available for the virus and kind of in what settings and, you know, kind of where we are with testing now, so that as you're talking about the difference that you would like to see, people have a sense of context. So I'll turn it over to one of the doctors B, whoever wants to kind of set the stage a little bit.
Sounds good. Martha, you want to start and then I can take over after that?
Sure. Yeah, one of the main ways that we can really track this epidemic, pandemic in our local area is by quickly identifying who has the disease and where the disease is spreading. So testing is absolutely critical for our response and identifying where we really need to take action. So unfortunately, there's been no very coordinated national response for testing. And everyone has felt that that has been, unfortunately, one of the real Achilles heels of a coordinated nationwide response to the pandemic. We've been left to ourselves as a state or a county or even individual localities to organize testing the best way we can. Now, part of that is we want to know absolutely when people are sick, whether or not they have COVID. But the other side of this is we want to know for those people who are feeling well, because we do know that for at least 2 or 3 days, people can feel completely normal with no symptoms, yet be infected. So that's also a little tricky because as healthcare systems, hospitals and clinics, we are here to diagnose and treat people who are injured and ill. So it's very interesting that now we have this disease where people may not be ill at all, but need to have a test for us to control the pandemic. So that's where public health comes in. It's clearly an issue for community health, public health, that we need to have as widely available, as easily as we possibly can, testing for anyone, whether or not they have symptoms. Now, that's been pretty clear that that's an effective way of identifying where the disease is spreading in your community. And once you know where it is, then you can do a much better job at controlling it. So that's kind of the stage that as we've said it, and we've had really a lot of help from the state, which has opened up state-run testing sites in our community. They've targeted those to areas where there are the largest number of cases, but unfortunately, they're not everywhere. And Monterey County is a gigantic, geographically large county and diverse county. And so unfortunately, the resources from the state for testing have really not reached the peninsula. So that's also part of the issue. And then, like I said, when you are a healthcare facility that is providing care for people who are sick or injured, we're not in the business of offering tests to everyone who is completely healthy without symptoms. So that's this really difficult juncture between public health and individual health. And we've had a hard time with this pandemic realizing that all those people need to have access to testing. And so that's definitely been a challenge. And a lot of, well, community hospital, as well as Salinas Valley Memorial and Natividad have cooperated with Visiting Nurse Association and with the county to stand up additional testing sites, particularly to get those people who want to have a test that don't have any symptoms, but are concerned that they could be one of those asymptomatic people out there spreading disease. So again, we continue to try and merge or bridge this divide between public health and individual health by doing those things. But in a lot of ways, we could do more. And I'll let Dr. Bakhda talk about a very compelling idea that has come out of Harvard professor, Dr. Michael Mina, who's been the real proponent of this idea of sort of universal daily testing for everyone as a way of really being able to pinpoint in real time where the cases are in any community. So I'll let Dr. Bakhda talk more about that approach.
Great, thank you. And I will just toss in here that as you alluded to, because there really hasn't been a broad national effort and, you know, we're dealing with constrained resources, they're really, I mean, at first, we weren't, we being, you know, public health, any of the health folks and elected officials, we were really not thinking that we had the resources to even test people who weren't symptomatic. And then gradually more testing sites and so on have come online, and the ability to have more people get tested has happened. Then we ran into the problem of the laboratories getting overwhelmed because there were so many tests that they couldn't keep up with processing them. And so then people kind of went, well, why bother? Because I don't get my test in time. So am I just going to quarantine myself for 10 days or 2 weeks while I wait? I mean, I could have just done that without a test. I mean, so it's been a, you know, as you suggest, it really hasn't been the smoothest, most rational process. But of course, that is what happens when we, well, yeah, even when something this big happens fairly unexpectedly. So we're all kind of scrambling, trying to do our best. And I think there's been quite a bit that's happened in California and in Monterey County. But as you say, we're far from having the amount of testing. I know as people were thinking about whether schools were going to open, the whole idea of making sure that the teachers and the students could know whether they were positive or not was a real stumbling block to the ability of schools to feel that they could open safely and parents to feel like they could safely send their kids to school. So anyway, it's just a, you know, further amplification of the points that you're making.
Yes. So
Dr. Bakhda, tell us about what is on the possible horizon here.
Absolutely. So, so first of all, thanks for having us. It's nice to be able to chat with you, and we're hoping to get your help to make this happen, because what we really need is the help of our elected officials to make this happen. And I've been thinking that Monterey County is an ideal place to start this project. So Dr. Blum explained a lot about testing and where we've gone with it. I'm going to try and break this down. And the analogy that I like to use, and I didn't come up with this, so I can't claim credit for this, but it's like coffee. We all need coffee. Everybody needs caffeine. Lord only knows I'm distance learning with my kids. And if mommy and daddy aren't caffeinated, ain't nothing happening. So everybody needs coffee for the most part in the morning, especially now. You kind of have a couple of choices. You can say, I'm going to go to Starbucks and I'm going to have the barista make this perfect triple venti cappuccino with just the right amount of foam on top. Okay. Or you could say, well, I kind of want something nice. I have my Nespresso machine at home. I don't want to go to Starbucks, but I'm going to have my Nespresso, and I'm going to make my nice, espresso with the little machine at home. And then sometimes you just say, you know what, I want it quick and fast, and I'm just going to open up the taster's choice, and I'm going to have me some instant coffee. So think about those three options, right? When we're at the hospital, when we want to know and we're doing a COVID test, we have got to know whether this person is infected with COVID-19 or not, if they've got pneumonia or some other respiratory illness, and we need to know for sure, is this person infected with COVID? So what we use is something called a PCR test, and that stands for polymerase chain reaction, and you can say that 5 times fast, you get a prize. But this is a miracle of modern technology where we take copies of viral DNA and essentially put it in a photocopier and copy it a bunch of times until there's enough that we can see whether or not there's viral RNA, the viral genetic material, in your sample. And this is what we need in the hospital. This is like going to Starbucks. And if you think about going to Starbucks, you have to have the barista, you have to have the machine, you have to have the, all the special coffee and the tamper and all that material and all those things that you need to make a perfect cup of Starbucks coffee. And so if you don't have any of those, or you don't have the barista, you can't get your cup. It's not going to happen. And that's what's been happening with PCR. Not only that, but we're trying to use, not everybody gets Starbucks every morning. And we're trying to use this super specialized test to test everybody. That's not really what we need. And so when you look at the PCR test, you're actually looking for the actual viral genetic material. The other option is that you don't look for that genetic material, but instead you look for the protein, a little piece of the virus that lives on the surface of the virus, and that's called an antigen. That's different from an antibody test, totally separate. We're talking about something called an antigen test. And basically what you're looking for is, suppose you were in a lineup of people that may have committed a crime, and you say, I'm looking for somebody that's wearing a red 49ers jersey. Okay, so you're just looking for that jersey. You're not necessarily looking for the person, but you're looking for that very distinctive signature that only is expressed by the COVID-19 virus. And so that's called the antigen. So there's a couple of different types of antigen testing. And so for right now, actually, there's a great article today in the East Bay Times about how the Pac-12, the football conference, is using this type of testing to screen all their players because it's much faster and easier to do than a PCR test. And they're using something called a Quidel machine, which is, again, it's a machine-based test that is a little expensive, but it works, takes 15 minutes, and looks for the antigen. That's like the Nespresso model, right? It's a little more expensive. It's going to give you a really good cup of coffee, maybe not quite as good as Starbucks, but pretty darn good. And that's like what we call machine-based rapid antigen testing, which is what we're seeing out there right now. When people are talking about rapid tests, right now, this is what they're talking about, a machine-based Nespresso model.
And can I ask you a question about that?
Yeah.
So I think I heard that maybe Salinas Valley Memorial or one of the hospitals, maybe you all at a community hospital have some kind of quicker test. Is this what it is, or or what they have, or that I've heard about, is a PCR test that just they have the lab capabilities to get the results more quickly?
Yeah, and I think both Salinas Valley, I think they have the Abbott ID Now. Martha, correct me if I'm wrong, but they have the Abbott ID Now test. We have one called the Cepheid Test, and the Abbott is about 15 to 20 minutes. I think that's the one they have at the White House that they're testing everybody with. We have a machine called the Cepheid, which can give us results in about an hour. But we've been out of reagent for it for at least the last month or so. So we have a different test that's probably more like 3 to 6 hours. But that's what they're talking about. So those are still PCR tests. They're just very fast. But again, it's like having that really super good barista at Starbucks. If he's not working or she's not working that day, you're not getting your cup of coffee that quickly. And we've got a good barista, but they're not as quick. So that's what a lot of people are talking about, the rapid testing. And then the Quidel and some of the other ones are these rapid antigen tests. What I would love to see is instant coffee. We're talking about taster's choice. You buy it in the store. It's a couple of bucks, but oh my goodness, you throw a cup of water in the microwave and pour it over, and you've got coffee and you've got caffeine. It's not perfect. It's not as good as Starbucks. It's not even as good as an espresso, but it's cheap and easy and fast, which is what we need. It's like they say, when you go to the mechanic, you can have fast, good, or cheap. And what we really want right now is fast and cheap and really good enough. So what we really want is we want something, I'm not looking, if I'm out in the community, I don't necessarily need to know with the level of diagnostics that we have at a hospital lab, whether or not somebody has COVID-19 1,000% for sure. What I want to know is, are you infectious? Are you contagious? Am I walking into a room with a bunch of contagious people, or vice versa? Am I contagious and I'm going to spread this to everybody in this workspace, this restaurant, or this school classroom? And that's where I really think we need to go. And this is what the movement on rapid, and when we talk about rapid testing, a better name for it, some people are calling it daily quick tests. And this is what we're talking about. Lots and lots and lots of cheap rapid tests that you can do at home. You could do at the workplace. You can do before you go into school, that, you spit in a cup, or you take a little bit of saliva, or maybe a little nasal swab, not the brain biopsy swab, but just on the outside of your nose, where you're just testing quickly and you get an answer right away and you say, okay, I'm good, I'm negative, I can go into this restaurant. I'm thinking about all of our essential workers out there and our farm workers out in the fields. When they're all in their line for those buses, taking them to the fields, great. Everybody gets a swab or a spit in the cup. And before they get on the bus even to go to the fields, are they infectious or not? And do you have COVID? Are you going to spread this to other people? The thing about these tests is they're not perfect. They're not as good as your PCR tests, but they're good enough because they're going to detect somebody who has a high enough viral load. They're putting out enough copies of the virus that they're going to infect you or me. And the thing about COVID is that it's not, just very brief casual contact probably isn't going to infect you. What you need is a few minutes of contact in an enclosed space, especially in a room, around other people, close contact, and usually indoors, although not always. That's what you need in order to convey enough virus. And what is the concerning thing is that you can be shedding or putting out enough virus early on before you even start getting the sniffles or the cough. Because if you get the sniffles and the cough, yeah, you're going to stay home. You're going to do the right thing and not be around other people. The problem comes is these people who are pre-symptomatic. There are some people who what we call asymptomatic, meaning they have no symptoms, and probably there's more of the problem with the people who go to a party with their family and their grandma, and then on a Sunday, and then on Tuesday they start getting the sniffles. Well, guess what? On Sunday they were already pre-symptomatic and infectious. Well, what if instead of walking into the house with grandma said, "Hold it, before you come in, spit in this cup before I let you out on, out of my porch and in my house." This is the idea. And the goal would be to get something as easy to use as a pregnancy test. And again, like I said, these aren't perfect. You're gonna have some false negatives, meaning the test says it's negative when you're positive, probably because you're taking it a little too early. And you're gonna have maybe a few false positives, meaning the test says you're positive, even though you are in fact not infected with COVID. And the way around that is that's where the hospitals or the labs come in to say, okay, you had a couple of, maybe you do one of these tests and it's positive, you do it again, it's still positive, you say, uh-oh, I'm going to now quarantine myself. I'm not going to go to grandma's house. I'm not going to go to work. My kid's not going to go to school. And I'm going to go to my doctor or the lab or the hospital and get a confirmatory PCR test. And the idea with this is that that's when you take that sip of taster's choice. You're like, nope, I'm going to Starbucks and I'm getting my good cup of coffee. Same kind of thing. That's where you want to go. So this is, the idea of this is good, is fast, cheap, and good enough so that we can really screen the entire population. But you need lots of them. And this is where government comes in. So the problem with these tests is that they're not they're not approved by the FDA, because the FDA, from what we can tell, they want the same sensitivity as the PCR test. They want it to be as good as the lab-based expensive PCR test. And again, you know, when you're going to the store to buy a can of Taster Choice, you know it's not going to be as good as Starbucks. And you're willing to accept that because it's cheaper and easier and faster. And that's the same idea here. So the two options are, number one, we can wait for the FDA to approve these. And I don't know if that's going to happen for whatever reason. I'm going to try not to be political on here, but I don't know if they're going to approve those because they don't want more tests, or they're stuck in this mindset of, well, it has to be perfect. The other option is that the FDA has to approve what we call screening tests, and they have to approve diagnostic tests. What they don't have to approve are surveillance tests. And this is where the state comes in, because state departments of public health, like ours, can approve surveillance testing without FDA approval. And so this is the idea that if we can get Governor Newsom and the California Department of Public Health to approve these types of tests to use in a community as surveillance, we can get these out there. And so my hope is that, and I know Dr. Blum's interested, I'm interested, I've got dozens of doctors and nurses and nurse practitioners and health professionals who would love to participate in doing this and say, let's use this as surveillance. Let's surveil our community. Let's surveil our farm workers. Let's surveil our kids. Let's do surveillance testing en masse on the peninsula, in Salinas, in South County. And let's get our people tested so we know where this virus is. And then we can say, okay, great, we're good. You're infectious. You go home, you stay there. If we do enough testing, we're talking about a matter of weeks before we can get this thing under control in the community. And in places like the peninsula, especially, which I know has been super frustrated because our rates in the peninsula are pretty low, you can say, hey, guess what? You know what? Our local rates are pretty good and you're negative. Great. You can go to work. You can go to school. We can get our kids back in school. And so this is where I think, to quote a phrase, this is the way. This is how we can get this done, and we can get our kids back in school. We can save lives. We can keep our essential workers safe, and we can reopen our economy and do it at a relatively low price, a heck of a lot cheaper than shutdowns. So that's my long spiel, but I think it's a really interesting idea, and I think it's something we can do here. I think we have a great population. I think we have a relatively small but geographically isolated community that I think people are involved enough and intelligent enough and cooperative enough and eager to do this to say, let's do this.
Great, thank you. I think that really kind of puts kind of gives people an idea. We've got a couple of comments. One is about a friend who had gone to community hospital to give birth, and of course had to have a COVID test on the way in, and was hoping to be able to use nitrous oxide as part of the birthing process, I guess. And she was told that she couldn't have nitrous oxide until the results came back from the COVID test. And she gave birth 7 hours later with no results to the test. And even when she was discharged, and so it kind of gets to your point that the going for the barista coffee has some real disadvantages. And then the other comment is, well, there were two more comments. One was just saying you're awesome. So that's pretty quick to convey. And then another comment is the fact that seniors often are very, very concerned about letting family members,
right.
This example was, I know a senior couple in their later 80s who will not allow their adult children to even come into their yard to talk
right.
with them through a closed window for fear of COVID-19. Probably pretty, they're the right demographic to have concerns. This worries the family as it has completely isolated the older couple.
Right.
A reliable and expensive test that could be done before arriving at grandma's would go a long way to reducing the isolation and possible depression.
Absolutely.
So one of the issues that the people in public health raise, and that you acknowledged yourself, is that it doesn't have the degree of reliability that some of the other tests have. And so in the case, how do you deal with, what would be the way to deal with, so we'll use the senior couple as an example. They have their family members, or they have their family members come over, spit in the cup, however you determine yes or no, right there so they can see. What if it's a false negative? Is there a way to say, if you're really concerned, have your instant coffee 3 days or some number of days before you come over, just in case, because that allows the incubation period, or I don't know. So what's the concept there if you want to be really conservative?
Yeah, I mean, so there's no easy answer, because what we're talking about is risk management, right? And we call it in medicine, we call it risk stratification, right? You can't tell 100%, but you're going to do testing to decrease your risk. So I think if you're talking about somebody on the peninsula where we have a relatively low rate of infection right now, the chances that you're going to be positive just off the bat are pretty low. So we can say with much more reliability to say, you probably weren't infectious beforehand, and we got this test that's going to reduce your rate even more. So if, we take you down from, say, 80% chance of being negative, and then you add this and you say, okay, now we've added this, we're down to like 95%. And everybody's got to take that. I'm throwing these numbers out. I have there's nothing concrete on there, but just for example, right? And so you're going to have to sit here and take that chance and say, okay, I think at a 95% chance of negative, I'm much more comfortable taking that than what we have right now, which is basically zero. We have no idea whether somebody's potentially infectious or not. So this decreases your risk significantly by saying, I'm pretty sure that things are safe. And these don't replace what we're already doing. This doesn't replace social distancing. Yeah.
You would still proceed with your visit with all of the recommendations that you would be wearing masks. Of course, if you're not eating, or if you're eating, you would maintain a safe social distance. You would have these interactions outside for the most part, if you could. So the test would just be one added piece of information to give further reassurance for people that are not feeling any symptoms, to say that, okay, it's a little safer for you to proceed to have this interaction, particularly with, family members. I know that grandparents wanting to see grandkids, or all of our assisted living facilities that, have essentially been locked down and not allowing anyone to have visitors. I mean, this could certainly open it up so that even with following the appropriate social distancing and face coverings, it would be another thing that would give people some reassurance on top of that. And, just as you pointed out, same thing, you would still be screening people for symptoms. You would still be, if you were to use this like in a university dormitory or a school setting, it wouldn't replace or completely take away all of those things that we've been doing already.
Right. Where I see this coming in is we've been doing people have been doing a lot of temperature screenings, right? And it's difficult to know how helpful those are, because yes, people get a fever with COVID, but they usually don't get a fever until they've had some of these other symptoms. So checking your temperature, maybe not as helpful. This replaces or augments the temperature screening. I don't want to say replaces, but this is a much better way of screening somebody to see if you're at higher risk for COVID. You say, yep, you're negative, great. We're going to have you come in. You're going to still keep your distance. But boy, wouldn't it be nice for grandma to say, okay, I'm much more confident that you're not infected before I let you into my house. We get this all the time in the emergency department, where people come in and we blocked visitors from coming in. And it's horrible. I mean, I had an absolutely heartbreaking case yesterday where I had to tell this 90-plus-year-old gentleman that his cancer had come back, and he didn't have his family there. His daughter was on the phone that I had to call later, and it was just horrible because he was by himself, and it was just me and him. And I wish there was a family member there just to hold his hand and give him a hug. And if we had this, we could at least say, okay, I'm going to do a quick screen on you. Yep, you're negative. Great. Come on back. And we have some news to share. And, you know, just the human part of this has just been so devastating because we don't have an easy way of rapidly screening somebody with any sort of reliability to say, yeah, we're pretty sure you're not going to, you know, convey this to other people. And that's, you know, another part of this is that, again, we're not looking, this doesn't look to see if you for sure are infected with COVID or not. This is a contagiousness test. Are you shedding enough virus that you're going to infect somebody else? And that's really the key to think about this, is that this is not a diagnostic test. This is a contagiousness test. Are you contagious? Because that's where this is really going to make a huge difference. But yeah, it's not perfect. And we're going to need to do a lot of work on, you know, the protocols. Like I said, what happens if your test is positive? And then what happens if you take another one and it's negative? Now what do you do? And those are things that we're going to need to figure out. And, you know, to me, it's like, if you have an equivocal thing, then you're going to need to go and get a formal test. But those are all questions that we are going to need to answer. But to me, the first step is to say, let's get this in process and then let's get it going. Because the other thing is, nobody's really done this before in the country. You know, I'm not sure if they're doing anything like this elsewhere, but as far as I can tell, it's really more of the, you know, the Nespresso model, the machine-based antigen testing. So, you know, maybe we'd be on the front lines of the first people to do that. And I think I can't think of a better place to do it than us. I think we're a great place to get this trialed out and get this started.
Very interesting. Dr. Blum, is there anything you wanted to say? There are a couple more questions coming in. I'm happy to move to them.
I just wanted to circle back to two things that Dr. Bakhda had brought up. One is the antigen test. So the antigen is not for the virus RNA, but for the protein. And this is a rapid test. And again, it suffers from the same issues that we have with the rapid test that we've been talking about for the virus, is that it may not be as sensitive as the Starbucks PCR test. But that test is available on the peninsula. That is the test that's being offered at doctors on duty. It's also being offered in some primary care offices, including those of the Montage Medical Group. So this is a test where the results would come back in 15 to 20 minutes. And the recommendation, though, as we were saying here, is that if that test is positive, many of those patients may be referred to get the PCR test afterwards to confirm. But even our health department is accepting those antigen tests as, if they're positive, that it is a probable case of COVID-19. So we do have some places on the peninsula where people can get those rapid antigen tests done, so they would know before leaving the doctor's office whether or not it was very likely that they had COVID-19 or not. So some of those are going to be distributed to some skilled nursing facilities, so to local nursing homes, that in case they have an outbreak there, they could rapidly go around the nursing home and test all of the residents and staff members and get an answer, you know, in a few hours if anybody else is positive for the antigen. So it is very powerful to have those results so quickly. The other thing that I wanted to point out is about whether or not any of these tests tell you whether you're contagious. And that is really been a challenge, because the PCR test is so sensitive. It is so sensitive. It can pick up just a few copies of the virus, but it cannot tell you whether or not you're contagious. So we speculate that we are picking up a large number of people who may not even still be contagious. They may have been sick 2 weeks ago, 3 weeks ago, in some cases 6 weeks ago. They're coming to us because they're going to have a surgery. So we do the PCR test and it comes back positive. And this person has absolutely no symptoms suggestive of COVID-19 whatsoever, but their test is positive. And so it leads to all sorts of questions about, well, what does that mean? And oftentimes what it means is that you ask them and they say, oh, you know, last month I felt really sick and I just quarantined at home because I figured, why would I go out and get a test? I'll just stay home. They did all the right things. And here they are coming in for their surgery for completely unrelated reasons, and they have a positive COVID test. So our PCR test does not tell whether or not someone is contagious. And so that's another real problem with that kind of testing. But the rapid testing, you must have a very high level of the virus for that to be positive. It's those people that have extremely high levels of the virus that are the ones that are very likely contagious and spreading this on and propagating the pandemic. So that's where the power comes in.
I see. So what you're saying is, and this I didn't know as just a general person, that that we know more about how the virus is transmitted, and that there are levels of you called it virus shedding, but I mean that there are people who could be like pre-symptomatic, but they're early enough in that process that they're not actually contagious, and or they're far enough that it's far enough in the past that they are not contagious. So that what you're focusing on is the you know, how risky is this person at this time in terms of being able to spread the virus to people if they come into contact with them.
That's exactly right. I mean, you know, in a healthcare setting, you know, we're interested in making the diagnosis if somebody comes in sick with COVID, like absolutely. And we want to know that down to like one single copy of the virus, you know, so that's why we really value those very sensitive diagnostic tests. But if you really want to know who out there, symptomatic or not, if they have high levels of the virus, you don't need a very sophisticated test. You could use one of these lower, less sophisticated, lower sensitivity tests and still identify those contagious individuals. And that's very powerful for stopping the spread of the virus in the community.
Yep. Hey, it's like a pregnancy test, you know, it's something as easy to use that you could theoretically buy in a drugstore and just take home and open it up and use that. It's an easy to use test.
Okay, great. Let me get to a couple of the questions here. And you've touched on this a bit, but I want to be sure that the question gets answered thoroughly. So one person is asking if you could tell us what the protocol is at community hospital for testing for COVID-19, who can be tested, how long does it take for results, and then how the results get communicated to the person. And you may have a couple of, well, right now you don't have your quicker test, your Cepheid 1 hour thing, but maybe just.
So at community hospital, we're testing both symptomatic and asymptomatic people. So if you come into our emergency department with symptoms that are suggestive of COVID-19, you're going to get the most rapid test we have, which right now takes about 4 hours or so turnaround time. So you'll get that test right away as you're coming into the hospital, presumably being admitted because you're sick enough with signs and symptoms of COVID. Now, anyone who's coming in who's not so sick that they're well enough that they can go home and care for themselves at home, although they're having symptoms, those people are also getting tested with a turnaround time of about 24 to 36 hours. And then we're doing, I'd have to tell you, at least 2/3, if not more than 2/3 of all the testing done at community hospital is done on asymptomatic people. So these are people who are coming here for surgeries or procedures or other services. And those tests are going to a variety of places depending on what sort of service or procedure you're having. And those test results, again, come back anywhere from 36 to 72 hours before you have your procedure or your service. So, you know, we're doing testing across the board, and anyone now who's being admitted to the hospital for more or less any reason is being offered a COVID test.
So you would, in order to get a test at community hospital, you would either need to show up in the emergency room with symptoms,
Yes.
or you would need to be in the pipeline for another hospital procedure, and you would get a test to verify that you were COVID negative before you would be admitted.
Yes.
So you couldn't just say, gee, I wonder if I have the virus, and show up and be able to get the test.
Yeah.
Not at community hospital. So,
No.
but you could at, I believe the Planned Parenthood site at MPC
Yes.
is still happening. That's a place where people can go. And again, it's that probably 3-day turnaround for the lab results. And then the Visiting Nurse Association is doing testing. I believe they're in Seaside now, but those are pop-ups, so they are in a certain community for a certain amount of time, and then they move along. Let's see, let me
thanks, Wendy.
On some other questions. Okay, great. Yes, so here's some information on the screen about where you can get tested.
And then we will definitely test anybody that's symptomatic as well. We're asking if you don't have symptoms and you're just worried to seek out one of these. But if you have symptoms, and they can be pretty minor, a cough, a cold, we have people with diarrhea, interestingly enough, that if people have significant diarrhea as their only symptom with COVID, to come on into the hospital and let us check you out. We're the emergency department. We're happy to take care of you and see people for COVID or for anything else. I know one of the things that's happened is that people have felt that they can't get care, or they're worried about coming to the hospital because they're worried about catching COVID. And it's really important to know that we are absolutely vigilant about making sure that that doesn't happen. The first rule of medicine is first do no harm, and that includes infectious disease. So we keep people with suspected COVID or confirmed COVID away from the rest of the hospital. We are very vigilant about making sure we're keeping our staff safe so that we're not giving anything to anybody else. Everybody gets screened every day before they come into the hospital for symptoms. And all the staff. And there's actually a new report that just came out, a new study that says that your risk of catching COVID from the hospital is actually probably less than it would be from just being in the general community. So we really want to encourage people to come on. Yeah, exactly. Yeah. The other thing that I think we really want to emphasize is that everybody's got to get their flu shot, because the symptoms between COVID and the flu are especially so similar, especially early on, that we want to take that out of the equation. We don't want you to have to come in with flu symptoms and be worried, is it the flu or is it COVID? And by getting your flu shot, we can either prevent the flu or at least decrease the severity significantly. So hopefully, we're not having to worry about that. So we really, really, really want everybody to get their flu shot. I literally just got mine today. So go get yours.
It's not too early. I've heard a lot of people wondering about, is the flu season going to be different because of COVID-19, because we're all wearing face coverings, so maybe we don't need to worry about flu. No, it's the complete opposite. You need to go and get your flu shot as soon as possible. Again, as Dr. Bakhda says, just take it out of the equation. Like, don't even make it an issue. Get your flu shot. You'll develop immunity in about 10 to 14 days, and it'll last plenty long enough to get you through this flu season. So it's never too early. Now is a good time.
Great, thank you. And if one of our brilliant folks behind the scenes here can find any local information about where flu shots are available, that would be handy to put up on the screen. So a couple questions here. Is there only one company that's making the rapid surveillance test, or multiple?
So there's a few that are out there, and there's one called E25 Bio, there's one called Sherlock, there's one called Sonatech. The problem is that none of this has been approved. So there's a bunch of folks who are kind of eager and ready to go, but not quite there yet. And I will not jump into the legal aspects of this or that, but for what I understand, if you're doing this as a state-based surveillance test, it might have to be produced in state. I don't know that answer, and that's something that I would leave to you, Jane, and the folks up in Sacramento. But goodness knows if we in California can't make these en masse, I don't know who can. I mean, we've got the resources in the state, and the folks up in Silicon Valley, just right up the street, that we should be able to put something together. And for those companies that are out of state, surely they can come up with some sort of local partner to manufacture these and make these en masse. I think it's just a question of really the political will to say, we're going to do this. We're going to have CDPH, the California Department of Public Health, give their imprimatur to it and then execute from there.
Which leads to the question of what's the process to get this approved? And then someone else had a question of, if the state or the feds aren't, moving rapidly enough, could the county health department approve this for use just in our county?
So from what I understand, it's got to be either FDA approved or, like I said, if it's surveillance testing, it needs to come from state level stuff. So I don't think, as much as I'd love to sit here and say we could do it locally, I think this is something that needs to be at a state level. Not to mention the fact that this is going to need a lot of resources to produce. This is not something that you can just make enough of in your backyard or in your garage. You need manufacturing capabilities to make enough of these to make an effect. Because if we're talking about doing one of these every day, or maybe a couple times a day, just in our community, we're going to need thousands. And the idea is that these are something that's just you print out on a sheet using manufacturing techniques, and you print out thousands of these and cut the sheets up and turn them into little gizmos. But somebody still needs to make the widgets, basically. And this is where getting the state machinery involved is going to be critical.
Any idea? So, and is this something that the governor can do through executive order, or is it something that the legislature would have to pass? And any clue about how much these would cost?
So, again, I don't know that answer because it's kind of uncharted territory, and I'm going to quote Star Trek and say I'm a doctor, not a legislator. But I think this is probably something that would be executive level, leadership type stuff. I don't think it needs legislation necessarily because it's public health. So I think this would be something that, the governor can, order CDPH to investigate and execute. The cost of these is lower than you think. So right now, Abbott, the people that have the Abbott ID now, they just developed something, I think it's called Binax, right, Dr. Blum? That's a antigen-based testing that still needs a physician order, but it's a rapid antigen-based test like this. The idea is that these would come down to the cost of about $1 a test. That is probably final state. I think early on, they're going to be more expensive. I would hope like $5 a test, but I don't know. That's a question for the manufacturers and things like that. But I think that would be the goal would be to get these down to $1 a test eventually. There'd need to be some money involved to get this going. But I would imagine that between government as well as the private sector, I think this is ideal for some sort of a public-private partnership between, I'm sure, Tamimura and Antle and Robinson Fresh and all of our local ag folks would be eager to do some screening on their workers, and the cost for them from a lost productivity standpoint has got to be a lot more than the cost of the tests. Combine that with the Convention and Visitors Bureau and the restaurant industry, and the costs of not doing this are staggering. So it's one of those things where you can spend a little money and make more money on the back end because you can actually get people back to work.
So I was actually going to ask about, because when you were talking before, I kind of had the impression that you were focusing on the Monterey Peninsula, but now you're talking about like the ag companies and the ag workers really being able to use this as well.
Yeah, I would think that a good starting point would be, because if we're doing this, we should start with the hotspots first and work our way backwards. In the example we talked about earlier, as much as I want to get that family back to see their grandma and to be able to have a lunch with grandma, I want to get our farm workers taken care of. I want to get our healthcare workers taken care of, and I want to get our kids back in school. So to me, those would be an ideal first three spots, is to say, and also let's not forget our folks in our incarcerated folks in jail and the correctional officers that are taking care of them. I mean, when you look at hotspots and outbreaks, those are probably our big places. We're looking at, the agricultural workers and their multi-generational families. We're looking at jails. And then if we're talking about restarting our economy, getting our kids back to school is so critical that I would say, let's get our kids back to school. And then of course, the people that are literally on the front lines dealing with this every day. So, I mean, I would look at those four areas as places to start, and then you go from there and you broaden out from there.
Mm-hmm. And I guess just as a, not quite devil's advocate, but one of the things that I've seen is, for instance, when we opened up a fair number of businesses in June, it's almost like people thought, oh, the businesses are opening, therefore it must all be okay. And boy, there was not a lot of compliance with some of the things that we know are absolutely fundamental. So I guess, what are your thoughts about how to message that? I mean, I just worry about the false sense of security that this might lend, so that you might inadvertently create as many problems as you're solving.
Yeah, human psychology is hard. And it's tough. And of course, like anything else, everything gets politicized no matter what. But I think it's really good coordinated messaging to say, this is not the end. This is just a step. You still have to wear your mask. You still have to social distance. And these are not perfect. And I think, people are intelligent. You have to level with people and say, this is not a perfect solution. This is a step. This is a stair. This is not, you're not in an elevator straight to, stage 4, right? This is, how do you get out of stage 2? And we're talking about, crawl, walk, run, right? We got to crawl before we walk. We're not even at crawling yet. So let's crawl. And that's a really, I'm not sure how else to communicate that. But I think a lot of really good education to people to say, yes, we know this isn't perfect. This is not perfect. This is better than nothing. And really messaging that out to everybody. I think that's the first step. Dr. Blum, do you have any other thoughts on that one?
I was just going to say, I think that when and if we get to a point where someone manufactures something that is feasible to be cheap enough and distributed widely enough, that this type of testing would have to be implemented as part of a comprehensive approach. Right. It couldn't just be, here's your test strip, great, you're ready to come to work. It would be just added on to whatever that employer or that school district already had in place. So it would be whatever social distancing, face coverings, disinfection, ventilation, all of those things would still have to be there. So I would not imagine that this would be anything other than added on to that.
I think that makes sense. One of our participants is asking or, suggesting that one way to think about this would be to have a COVID compliance officer be part of, most workplaces. And that could help. I think I can see it as part of an employment situation from the public health side of things, because that's part of my view on this, because at the county level we are responsible for the public health. The idea of doing it as part of an employment situation makes sense to me, because then when there is a positive, then there is a better mechanism for getting that reported to the public health department for contact tracing. So just having it be something that people do at home, I get it that it's cheaper and it's, it's on the order of instant coffee. But when you get a positive, you need to have a reliable mechanism
Right.
There's reporting so that there can be the contact tracing and the quarantining and the follow-up and all the things that need to happen. So I guess that's sort of in the category of to be worked out, but to me that would be really critical.
Yeah. Right. Well, you pointed out earlier that right now we have this major failing where people aren't getting their test results back until, you're sick a couple days, you go and get the test, you wait 4 more days to get the test result, and then you wait a few days to get the notification from the county for contact tracing. By now, you're practically done with your isolation period, and you've probably, unfortunately, already passed it on to those 2 or maybe 3 other people that's going to continue to propagate the pandemic. So, anything that we could possibly do to get this back to the point where the testing can result in effective contact tracing to keep this from spreading, it's absolutely essential.
Yeah, it's really, it's so different from the way we've been thinking about this and doing it that it's like, so I'm getting a number of enthusiastic comments about you, the Doctors B, as panelists, that people are really appreciating the information. And I think it's, kind of a contagiously exciting idea, if you will. And we're just about out of time. The time has just raced by. So I want to give, there are about 5 minutes left. And so I want to give both of you an opportunity to make any final comments that you would like to.
I will defer to Dr. Blum.
Thank you. Well, it's been just an interesting and challenging time for everyone. I used to be a university professor and would teach, microbiology. And right now it's literally, we are learning and teaching as we go along. And I've had to give a university level education to everyone. I mean, it's been challenging to try and process all this information. The fact that we're doing a Zoom call to talk about antigens and PCRs, again, is a bit mind-blowing. It's incredibly technically detailed stuff. And I do so appreciate, the supervisors and our public health department, everybody here trying to do their best to guide us all through this maze of information that seems to change constantly. But I think we're getting the main points out there, which is, testing has been something that's really fallen short, and here's a great opportunity to do something to kind of bring it to a point where it could actually be very useful in controlling the pandemic, so that we can all get back to being together with one another in person. So I would be very optimistic that if we can find a way to cut through the bureaucratic red tape and to get all those companies that are so eager to manufacture these types of tests, really get them whatever they need to make this a reality. I think that would be a very exciting development, together with a vaccine that hopefully we'll see in the months to come. But in the meantime, again, everybody has to strive to do their best to maintain social distance, keep those gatherings outdoors, wear their face coverings, and get your flu shot as early as possible. And hopefully we'll try and keep ourselves safe and healthy through the fall and winter.
Thank you, Dr. Blum. Dr. Bakhda, anything?
I think Dr. Blum kind of nailed it right there. I mean, so if people are interested in more information about this, you can go to rapidtests.org. Which is somebody in the Bay Area who's been putting this together. There's a epidemiologist called Dr. Michael Mina, M-I-N-A, who's really interesting and well worth watching his stuff. There's plenty of stuff online. There's lots of YouTubes and things like that featuring him. So I'd encourage you to take a look at that. And then I just want to reiterate what Dr. Blum said, is that the way to beat this is good public health, which is really underrated. And I'm hoping when we come out of this, we have a lot more emphasis on and funding for public health, because it's so critical. And it's one of those things like disaster management that when you ignore it, it comes back to bite you in the butt. But wash your hands, wear your mask, keep your droplets to yourself, because that's how this is spread. Get your flu shot. And if you're sick, come into the hospital, come in to see your doctor. We're here to take care of you, and we will make sure to protect you as well. So if you're worried, please don't hesitate. And whether it's respiratory illness or not, come and get us, come and let us take care of you, because that's what we're here for, and we're happy to do it.
Thank you. Thank you, Dr. Bakhda. Thank you, Dr. Blum, for being here. Really interesting conversation and exciting possibility for how we might be able to navigate even more safely over what could be the long term. I mean, I'm hearing that even if a vaccine were developed tomorrow, the production and distribution could take nearly a year. So, you know, it's really, we're in this for a while. And so really appreciate you bringing this up. I want to just mention to our Zoom and Facebook people that there is a link to where you can find flu shot locations. It's vaccinefinder.org. And then Wendy has also put up the website rapidtest.org. There's a link there. So please avail yourself of the information. And again, my thanks to Dr. Blum and Dr. Bakhda for getting us started on this conversation. So thanks, everyone. We'll see you next week for hot topics. And in the meantime, be safe and be kind.
Thank you.